Good afternoon, everyone. Sawadee ka, all Thai. So I know that many of you have been to Thailand, and I'm so glad to have the opportunity to meet with you here to talk about very interesting things in Indonesia. So my topic, as I was asked to work on, is health policy advocacy design. And I would first of all congratulate all Indonesians for having universal health insurance coverage, and also congratulate all the policy analysts, the researchers, for that we live and work in this exciting time. In every country where there is a universal health insurance coverage, there are so many changes. So many changes. So it is exciting, but sometimes it's also frustrating. Frustrating for many people because sometimes we want to see something happen, but things don't happen the way we actually wanted. And you know what? This is the nature of policy. Public policy is always like this, that it happened in such a way that many of them are not what we want, but some of them are what we want. I remember when I was Takemi, International Health Fellow at Harvard School of Public Health. There was Professor Bendot who came in, and he started the class by saying, imagine everyone that you are standing at the intersection, and then there are 4 racing cars coming in 4 directions, okay, and then suddenly all crash, and the rest, what's left, remain in the intersection is public policy. Because public policy is something that everybody wants to get, and sometimes not actually everybody wants, but some of the things are those we want, some of the things are not those we don't. But anyway, that's the nature of it. So allow me to bring you back to something that is broad about health insurance, universal health insurance coverage in history. Here is the chart that look at the introduction of health insurance coverage by public policy in different countries. And we would, there are, I think it's 12 countries in here, 12 countries in here. And we have some countries, the length of, probably can't. If you look at Germany, in 18 something, you have Bismarck trying to introduce health insurance for the population because of the economic purpose, for development purpose, not for the health purpose. And it evolved over the year until in 19, if I see clearly, 75, and there is a universal health coverage. Same for many different countries. Some takes long, some takes a little bit while, not many. Oh, very, very serious when health insurance was introduced. But even you achieve, any country achieve universal health insurance coverage, there are still, if you look at the dotted line, sometimes when the economy is good, they expand the benefit coverage. Sometimes when the economy is bad or there is budget constraint, there are there are the slight square that health insurance must shrink a little bit, benefits must be cut a little bit. Okay, so health insurance change over the time. Okay, and we have Thailand, Indonesia. This originated from a comparative study that I did long time ago and added Thailand and Indonesia. So even for Indonesia, it takes a long time. Okay, and what we learn from the development, the experiences of developing universal health insurance coverage is that in most countries, the process to achieve universal coverage takes a long time. And a country can achieve health insurance coverage only by government policy, by public policy. It has to be a mandate. We cannot rely on separate private initiative and other things. It has to be a mandate. And that means we are working on about fighting or whatever, struggling, negotiating on public policy. Changes to policy on health insurance can and do occur after the country achieving universal coverage. Expansion or maybe benefit restriction, cost control, and sometimes reorganization. At one time, South Korea had about 140 something fund holders, okay, the pools. And then they all reorganized and became one, something like that. It's all a policy process. And public policies to introduce health insurance are political process. Public policy is politics, as we all know. And although at the beginning in many countries, from what I have learned and discussed with health insurers, policymakers in many different countries, at the beginning there are always changes. Same thing happened in Taiwan, Thailand, and I'm sure in Indonesia today. Because at the first few years, always changes in rule. Even they ask you to input information in a software, in a program. And the program also, they develop very hastily and put it out, and then they change things, and they change rules. So this happened, and I'm thinking that probably this is happening in Indonesia at this point. And after a few years, it will settle. But the settlement doesn't mean that it will be no change. In the future, there will be change, because this is the process of public policy. And some of the factors from the history, the experiences of countries introducing universal health insurance coverage, we'll find that the process of politics we can take as a given is politics. But also in politics, we can identify certain things that may make introduction of public policy faster. Okay, make landslide, make something changes. And say, for example, that factor, like one of them is window of opportunity. In different countries, like in UK, the intention to introduce health insurance started for a long time. And it was because of after the Industrial Revolution, the workers, rural people move into the city, and then no health support, and then NGOs, charity organizations try to provide services, but not enough. So they push for the government to change. But then it took a long time. And then after World War II, things changed. Immediately, UK government introduced national health services. So when there is a window of opportunity, it happened. So it's important for policy advocacy. People who advocate will need to know how to identify and use window of opportunity. A lot of times, strong governments and leaders like Bismarck in Germany, like in Singapore, we know that Singapore one-party dominance for a long time since the beginning. And then in Singapore, it was initiated by the government. And then the government has an idea. It's not outside initiative in terms of setting policy agenda, but actually it's mobilization model. The government says we are going to do it, then they mobilize the public. It's not the public mobilize to pressure the government. It's the government. It's the government that mobilize the public. So these are the forces in politics that need to be identified for people who do policy advocacy. In Taiwan, it's also the same. The government wanted it, and all the professionals try to develop something. And in Thailand, I'm sure that all of you have heard of Thaksin Shinawatra, who was a strong prime minister, and now he lives in exile outside of the country. But he tried to be his populist policy and majority party make it happen. Although if you talk to me in details later on, there are many other things that he didn't want it that fast, but it became very fast for Thailand, and we improve it later on. We just wanted something in there. So there are factors like this, and in Western countries, what we see is political ideology, but in Asia, we rarely see introduction of universal health insurance as ideology differences. In US, we know that there is a long history starting from Theodore Roosevelt, okay, 1935 to introduce something, and Truman and Johnson, the Great Society, 1965, which resulted in Medicaid and Medicare. Clinton tried it and failed, and then Obama, okay, all Democrats wants to introduce universal health insurance coverage. Then Nixon changed it, and then Trump. We know that Trump already ordered something, and just this year, and we will see what happened. The result will come in next year, probably, hopefully. What will happen with Obamacare? So in the Western countries, a lot of time is political ideology. We can also use example of UK. Labour, it was Labour Party that introduced NHS, and then when Thatcher came in, she kind of shrinked NHS and reorganized NHS. And Australia, or if you look at Australian politics, many years that they submit the law, the bill, into the parliament, and then they fought, they enacted something, another government come in, they kind of canceled it. Back and forth many times before Australia start to have actually universal health insurance coverage. Same thing for New Zealand. So when we look back in history, it's all political process have involved in many stages, like agenda setting, policy formulation, and even policy adoption stage. You enact a law, and then another party come in and pull it out, something like that, back and forth. And so people who do policy advocacy certainly needs political skills. And then not enough. Political skills, not enough. They need to have a policy solution. They need to have like beverage report, green report, and in the case of Indonesia, the roadmap, to look into the details of the design, the structure of the health insurance package. So policy solution need to be available before one can seriously propose any policy change. And sometimes it's big, like the whole report that talk about the entire structure of the health insurance program. Sometimes it's just some technical models, like for example, DRG, diagnostic related group, case-based, case-mixed payment mechanism. So big and small, there are a need to have policy solutions so that we can effectively advocate, because we cannot advocate just to say we need to solve a problem alone. Solving a problem, but how? So that's the second thing that is an important factor for policy advocacy. Another thing is policy evidence. To say we need to change this, to say we need to change that, we need the evidence. Okay, so let me elaborate part of it as far as the time allow, different elements. Political skills. First, we need knowledge about the policy players. Of course, everybody knows that. But also policy content, and the interaction between the two. Not just policy players, but content. And I'm going to talk about this in a while. Knowledge of policy context, the context which will the policy, people who do policy advocacy would look at opportunities and also obstacles within the context and how to use them in order to do policy advocacy. And knowledge of public policy process, formal process and informal process. Because in public policy, as I mentioned earlier, there was a model developed by Kopp and Ross and Ross. Outside initiative. But sometimes policy doesn't come from outside of the government. A lot of times it's come from inside. And they mobilize the people, the population. Even there are other policies that are highly technical and probably not the population and the interest groups don't pay much attention. Like you change some of the benefits, some medicine list, like for example, and it's inside access. So policy advocator needs to understand that something is happening there without announcement. Okay, they announce only after they change. Okay, so that's the knowledge of public policy process is also very important, and the ability to identify and utilize window of opportunity. Okay, in different countries, different. It comes in different size and shape, window of opportunity, but that's those people who are in the field will know what happened. And so let me touch on the two key points a little bit. For policy players, policy advocacy requires the understanding of the player position and power. Position, not the formal statement, but the action. I remember in one drug policy, pharmaceutical policy in Thailand, the Importers Association say we support this policy, but actually they submitted a petition to say this is unconstitutional. But but officially in the media they said they support. So when we identify policy position, we don't take the official statement as policy position. We take the action as policy position. Okay, and also the power big and small, and as well as the players' interest. How much interest? What are the interests do they have? And is anything, if we have anything touching the interest for the good or for the bad, they can change position. And also players networks, we need to identify in policy advocacy. But one more thing that is very important, and then policy advocacy literature rarely emphasize this, and I would like to emphasize it here, is the policy content. We need to look at policy goals, and goals are many, broad goals and specific objectives, okay, which we should be able to identify one by one. Policy mechanisms require certain group in the population to pay, to contribute. Certain group will get it for free, and mandate the payment for like primary care physician different from the payment mechanism. Maybe pay primary care physician one way, hospital another way. So we need to understand the different mechanisms, okay, within the policy, because the different mechanisms affect different players differently. So this is needed to understand, to be understood. And policy indicators, what the government want to achieve, and by how much. And then the key point is to identify policy consequences for each of the players, each component and each player. I try to draw a diagram like this, and I cannot draw too many lines because I don't know how to do it. On the left-hand side, you have one piece of policy, public policy document. Within there, we need to understand the components or the mechanisms. Okay, the component, what does it say in number 1, number 2, number 3, number 4, number 5? And how does number 1 affect policy players, stakeholders? How does it affect whom? Whose interest will be affected? What will be the consequence if this particular policy component is implemented? Okay, not just the whole policy. If we say the whole policy, they say oppose or support, then there is not much thinking about changing, not much room. But if we tease out the policy components, mechanisms, then we will be able to identify A is affected by component 2. Component 2 is a big one, affect A, B, D, and component 4, C, and E, for example. The consequence, if there is implementation of this particular component, player B, which is a big one, will not like it. So is it important to achieving the component 2? We ask ourselves, is the component 2 very important, critical to achieve the overall policy goal? If yes, then we need to pursue. But if no, maybe some little changes can be done, then there can be prioritization, and then negotiation, and eventually some compromise at the beginning to allow the policy to take effect. Okay, so this the political process, the stakeholder analysis needs to come into this level, not just who support or who oppose policy as a whole. When stakeholder analysis can come into this level, we can make changes. We can kind of agree to move changes on this component and allow a little bit slower changes to come later on in another component. So that's the policy, the policy consequence analysis for player. And if we understand both policy content, players, and context, we can develop strategies on player positions, player number, interest, and also the consequence I just mentioned, and also opportunities and obstacles in the context. And that's the way to do political analysis of public policy, and will give you kind of a lot of room to play with. I need to go fast because time doesn't allow. This is called political mapping framework, and it was developed by Professor Michael Reich, my teacher, and a friend, my friend. And there is even a program, computer program, to allow you to play with. I'm not sure whether anybody is familiar with this one. This is a framework that is very useful, and then there is a program you can download for free. So you can just search Google. Google knows everything. So you can search Google and download and play with it. And it has detailed suggestions of strategies that people who do policy advocacy can use on different aspects. How to improve power of supporters, decrease power of opponents, how to decrease the number of opponents, something like that. So if you want to take a look, you can check. And another thing, the last item is policy solution. Policy advocacy requires the ability of availability of a policy model to respond to the problem. And that that model, is the ability to clearly address the problem of focus, and I'm going to give example, and ability to anticipate policy consequences. It's not just we have a model and we will get the whole nation to try, but we need to also be very clear and analyze. Let me give an example. This is an old model developed by Penchansky and Thomas, and we always talk about access to health, but different people study access differently. Some people means availability, some people means affordability, others means accessibility. Accessibility means you are able to get there to the health service interface. You can get into the service providers facilities. Okay, Indonesia is a big country and many islands, so accessibility sometimes is also one of the issue. Accommodation allow you to like long hours of services or this and that. Acceptability has to do whether the patients and the physicians accept it or the nurses accept it, like it related to cultural thinking as well as the religions. So I don't have time to go into the details, but the key point is this. When we propose a policy or when we advocate a policy change, we need to have something ready in hand, the solution. But in the solution, it must be very clear. We can say we want to improve access. Indonesia, JKN, improves access, but the part of access that health insurance improves is affordability. When affordability improves, increased, the demand increased. A lot of people, previously they don't have the money, now they can go and use the services. What happened when it interacts with availability? In Indonesia, a lot of areas in health service delivery still has shortage in terms of human resources, in terms of facilities, in terms of tests. Okay, many part. So many countries in my second slide, most of the countries, okay, that introduced universal health insurance coverage, they already had availability in place, quite adequate availability. So they say, okay, it's available, but maybe too expensive. So they introduce health insurance which address affordability directly. Maybe you pay enough, then availability will increase. So this is a thing of policy consequence that before we introduce a policy, we need to really understand. The Singapore case, before Singapore government introduced universal health insurance, which basically they will pay for, they cover in patient care, okay? But outpatient care, the people have to pay. They would anticipate beforehand that if we are going to pay for their inpatient care, the demand for outpatient care will be a lot, okay? And then there are community private clinics across the country, which will raise price. So what the Singaporean government did was they set up a lot of public sector community clinics and set the price very low to compete with the private sector clinics. So this is a thing about thinking about policy consequences before we introduce policy. So that's the idea that probably people who want to like propose policy, we need to think that beforehand. And so policy evidence is needed. We need evidence-based policy making, evidence-based policy advocacy as well. And one thing that when we try to produce policy evidence, and we might say that, okay, the policy failed here. In, say, for example, let me just give an example without much knowledge. Say one part of the JKN failed here in Georgia. We should, as policy researchers, Okay, we should be able to distinguish between what we call theoretical failure versus implementation failure. Theoretical failure means the policy is designed like this. The theory, the policy, every policy is based on a theory. So if we do this, this will happen. So that's theory. That is a theory. If we do this, if we have a policy to do this, we will solve this problem. So it's a causal relationship. But when we find failure, we need to really understand that, is it because of the structure that failed? Is a theory that failed? This what is written in the policy that failed, or the way it has been implemented? That because if it is the theory, if it is the policy content that failed, we would ask to change the policy content, rewrite the policy, at least on this particular part. But if it is implementation that fails, we need to improve policy implementation. So we need to be very specific, be very clear when we advocate changes in policy, where exactly is. So that's the distinguish between theoretical and implementation failure. So the research, evidence-based policy making, I think it needs to be, the policy research and feedback mechanism need to be built in, developed as built-in components in policy process. Yesterday I came and Pak Laksono talked about analysis of policy and analysis for policy. And that's the point, the very key concept in this. And there is another thing that we can do issue-based and area-based comparative research. Indonesia is a big country, and we have diversity. So maybe it is good to have, we identify issues and then try to follow up regularly, contacting different people in different areas, develop indicators. I came here to talk with many people on area-based comparative research for social change and policy monitoring. So if we can have different areas to work on that and do it regularly, every year, every 2 years, every 3 years, we can see, monitor, and evaluate policy change very easily. And also data system and access should be something included, and systematize and formalize mechanism for policy knowledge sharing and policy inputs. I have to go fast. I hope this is the last because time is up. I think policy advocacy need to be done by design. And not only the policy that we should study, policy advocacy can be an object of research. We study how we have done it, how others do it, so that we can learn from experience, to draw lessons, and to share experiences and to build network of policy advocates in order to do better and do more. And I saw from an article by former Minister of Health that in JKN process there is a socialization and advocacy component, and there was a working group set up. Maybe the government should do more in this area. And this another thing I just learned, Gotong Royong, I'm not sure whether I pronounce it correctly, mutual cooperation principle in health insurance. And I think not only health insurance, not only Gotong Royong in contributing financially and receiving benefit, but it should be broadened as mutual cooperation between the government, between the academics, the researchers, policy advocates, and the people, in order to try to cooperate in learning more also about how to improve universal health insurance coverage, and that's the policy analysis, and advocacy is part of the built-in process. Okay, so I'm sorry for exceeding the time. Thank you so much. Terima kasih.